Assalamu alaikum. The season is changing, autumn is in the air, the temperatures are changing, air has become dry and dusty. This has led to an increase in the number of respiratory allergy cases, which include all coughs, colds, and respiratory tract illnesses. And along with all these, the number of nasal epistaxis, that is, bleeding from the nose cases, have increased. I'm Dr. Mariam Atiq, and today let us discuss about the causes of these nosebleeds, what is the management for them, and what are the home remedies that you can do for it. And when does it become alarming and you need to consult the doctor. By nose bleeding, we mean bleeding from the inner lining of the nose, which is heavily armed with minute blood vessels which help in the exchange of gases. These are very fragile and they tend to bleed very easily. What are the common causes? First, again, the change in temperature, the dry and dusty air. Then there can be injury to the nasal septum. That injury can either be due to simply picking the nose, poking the nose, or it can be due to trauma, bump, or there can be a history of fall and injury directly to the nose, which can all lead to this. Then the respiratory allergies, they tend to cause irritation in the nasal lining, and as a result there is sneezing, and when the sneezing is very strong and continuous, that can lead to nasal bleeding. Then there can be the irritants and the pollutants in the air that trigger the allergic process, and as a result of this we tend to keep on poking it. These normally occur in the children and elderly more than in the adults, but in the adults also it can happen, and there can be more uncommon causes to it, which again you have to know because many of you are suffering from these ailments. And increased consumption of alcohol can lead to it. High blood pressure, if it becomes continuous, then it can manifest in the form of nosebleeds. Then atherosclerosis, that is hardening of the arteries and the vessels due to deposition of fat, can make these vessels fragile, and they can bleed easily. Then if there are nasal polyps or tumors in the nose, they can also lead to nose bleeding. If somebody has gone facial surgery, nasal surgery, this can again lead to nosebleeds. Then bleeding disorders such as hemophilia can be a cause of it. And then the hemorrhagic kinds of fevers such as the dengue fever, the Congo fever, they can all manifest in the form of nosebleeds. Then there are certain autoimmune diseases in which our own body starts decreasing the number of platelets. There is autoimmune thrombocytopenia, and these platelets are needed to clot the blood. So a deficiency of these platelets or faulty platelets can lead to nosebleeds. Now, how do you manage it? It may look very scary, but it is easily manageable normally at home, and we do not need to rush to the doctor. Until and unless the nasal bleeding continues for more than 20 minutes or there are more than 3 episodes in a week, then we must go to the doctor and get ourselves tested, get the different kinds of tests done as advised by the doctor to find out the actual cause for it. So what do you do? First and foremost, stay calm. It's scary, but it is not life-threatening. Then keep the head upright and above the level of the heart so that the amount of bleeding is reduced. Then we do the nose pinching method. Feel your nose. First is the bony part and then is the soft cartilaginous part. So with your thumb and index finger, press the junction between this bony part and the cartilaginous part, and then breathe from your mouth. This is called pinch and breathe. Pinch and breathe. Keep on doing this till the bleeding gets controlled. Then apply ice to the nose bridge so that the vessels can constrict and the bleeding can be controlled. In case ice is not available, then you can simply pour cold water on your head and face, and you can keep on doing the nose pinch method. Other than that, what are the home remedies that you can do? If the atmosphere is very dry and dusty, then start using the air purifiers and the air humidifiers to keep the air clean, free from bacteria and viruses, and to keep it in the normal humidity level so that the nasal lining does not become dry and does not crack. Then what else you can do? Use the nasal saline sprays again to keep the nasal lining moist. You can simply apply petroleum jelly inside your nose with the help of a cotton bud, or you can use any of the oils that are available at home. There may be the coconut oil, there may be mustard oil, olive oil, any of these will do. Do these simple remedies and drink lots and lots of water so that you stay hydrated. Following these steps, you can stay safe and you can easily manage it. So let's summarize. It is a common problem, manageable at home. Stay calm, do not panic, stay upright, the nose, pinch and breathe method, and stay hydrated. So we'll come back with another topic, and till then stay safe and stay healthy. Thank you. Assalamu alaikum.